It is incredibly common for breastfeeding to hurt. The thing is, it doesn't have to, and it doesn't have to for you. I know that there are so many breastfeeding experiences and stories out there that are so painful that ultimately it can change the course or end a lactation journey completely. This does not have to be the case for you. Welcome, beautiful families. I'm Nalini. I'm a lactation consultant and a nursing mama. I really enjoy helping families navigate all things Milkies, and through research, helping families, experiencing the ouch factor myself, I have compiled a quick go-to list of reasons why you might be experiencing pain while breastfeeding and narrow down what the heck is actually going on. If you're new here or haven't yet subscribed, go ahead and click that bell icon so that way you can get lactation information when you may need it most. Time to explore what may be causing you pain while breastfeeding. Be sure to watch or listen until the end so that way you can get the most out of that last tip and figure out what is going on in your journey. First up, nipple sensitivity. So, believe it or not, even with very sensitive nipples, nursing can be very painless. Pain is very different from tenderness or sensitivity, and I'm talking here that you wouldn't and shouldn't have that toe curling, ouchy, pinchy type of pain. Nipple sensitivity is common and normal within the first few days postpartum, simply because you are shifting from pregnancy to your new postpartum season. It is important to note that nipple sensitivity can resemble or is similar to the sensitivity or tenderness that you may have felt pre-pregnancy, during ovulation, or menstruation. This also means that nipple sensitivity can come and go at certain points during your lactation journey because of ovulation and menstruation. So yes, you can get pregnant while breastfeeding. Ta-da! Next up is engorgement. So while we have hormone shifting, we also had fluid moving around and redistributing itself in our bodies postpartum. When it comes to engorgement, this is usually due to swelling due to fluid building up in the breast. Your partner may look at you and think, wow, I didn't think your tatas were going to get any bigger. And you, on the other hand, might be thinking, make it stop. It does end, it does stop, it gets better, and not everyone experiences engorgement either. I do want to note that engorgement does not tell you if you are going to have an undersupply, an oversupply, or make the perfect amount of milk for your little one. The fluid that causes engorgement in the first week is a combination of clear fluid, similar to IV fluids that you would have gotten in the hospital if you gave birth in the hospital. And it's similar to having your feet swell, but instead of your feet swelling, it's your breasts swelling. And combined with your milk transitioning from colostrum to more mature milk for your little one. A common misconception is that engorgement is due to all milk just being filled up and can't come out, and that it gives moms this feeling that I need to get the milk out. While that might be true later on in a lactation journey, within the first week, again, it is a combination of inflammation and clear fluid, as well as milk transitioning from colostrum to more mature milk for your little one. Engorgement feels very tight and heavy and very full, and when fluid and milk collects rapidly in the breast, it can cause that tight, full, heavy feeling on the chest, in the breast, and sometimes it feels very hard, like a watermelon. It can also happen if there's too much stimulation at the breast, usually by pumping, or if your little one is unable to extract milk appropriately. Using appropriate breast massage techniques during pregnancy can actually help decrease the occurrence and severity of engorgement postpartum. I highly recommend practicing during pregnancy. The other thing is, there are other techniques too for massaging the breast that can actually reduce engorgement and bring comfort while you're experiencing it. I'm a huge advocate for massage, so I teach families how to do this themselves. That way they can get the relief they need, feel comfortable, and they can use it as a form of self-care. Beyond the first week, engorgement can still occur, especially if milk is not being extracted frequently enough or if mama has an oversupply. In this case, drainage as well as massage are key. Next, thrush. Ugh, this one is no fun. Not everybody experiences this, and it has to do with shooting, throbbing pains from the nipple into the rest of the breast. You can also have itchy or scaly red patches on the breast, and sometimes it can be a little difficult to detect on the skin itself, depending on skin tone. When it comes to your little one, you might notice that there are white patches or coating of white on your little one's cheeks on the inside and on their tongue that you just can't quite wipe off. This is an indication that there may be an overgrowth of yeast. Thrush, or an overgrowth of yeast, is a fungal infection. It can cause burning, soreness, and discomfort in both mom and baby. Both mom and baby have to be treated at the same time. Otherwise, it just goes back and forth from baby to mom, mom to baby, baby to mom, mom to baby. If you suspect thrush, I highly recommend and encourage you to check in with your lactation consultant. As a holistic lactation consultant and a nursing mom myself, yes, I am pregnant, but I am still nursing. I understand not wanting to jump to antibiotics, prescription creams, or steroids. It is really important and good to know that there are natural remedies that can restore balance in your body and your Milkies and your little one and bring both of you relief. Next up, clogs and mastitis. Clogs can occur when milk fat clumps together and basically plugs up a milk duct. We can think of a milk duct as a highway in which milk travels through. The clog at this point in the highway would be a bottleneck that milk can pass slowly around, or it can completely cause a blockage and milk builds up behind the clog. A clog can be very bothersome in itself, but it becomes very painful at times if it is obstructive enough that milk is building up and backing up behind the clog. The feeling associated with a clog that is obstructive enough to cause this discomfort usually can be pain, a hard spot, some shooting pain from the nipple back to the clog as well. And oftentimes the area can get a little sore or quite sore if we are poking and prodding at it. If the clog does not break apart and continues to block milk from flowing, then ultimately that can cause that particular milk duct to shut down, or at least tell your body to produce less milk. If there are pathogens or a buildup of bacteria that has created a home in that milk duct or in the clog itself, then that can cause an infection. This is one way to get mastitis. I want you to keep in mind that not all clogs turn into mastitis, and not all mastitis is due to an infection. Truly, mastitis is an inflammation of breast tissue, meaning it can be due to inflammation, which is not an infection, or it can be due to an infection. So what does mastitis feel like? It's not good. It's not good at all. It feels like the flu times 100, and that's my opinion on what it feels like. So clearly I've had my own share of this, but it does come with flu-like symptoms. So fever, aches, chills, like full-on body aches, and your breasts are just painful, especially the side that is actually experiencing the clog and it needs to be released and worked on. Seeking expert help early is crucial when it comes to mastitis for breast health, your sanity, and milk supply. Again, not every case of mastitis is due to an infection. This also means that not every case will need antibiotics. Most of the time, believe it or not, it can be resolved with milk flow techniques and natural remedies. With or without antibiotics, mastitis usually takes a course of a few days to a week. The use of antibiotics is something to think about because it does pass into breast milk and affect the good bacteria in your Milkies. Aside from getting rid of the mastitis and feeling relief, it is really important to understand why the mastitis happened in the first place, so that way it doesn't happen again. If mastitis occurs back to back, then usually that means that the root cause, or the why, was not established or figured out, meaning the mastitis was not completely resolved. Take a moment to hit that like button if you or someone you know will find the information in this video helpful. Next up, blebs. This is a weird one to even say, blebs, but if you've ever had one and you look down and you're like, oh, what is that? The word bleb kind of makes sense. A bleb is a painful spot either on the areola or the nipple. If it's on your nipple, then it's a spot in a nipple pore. If it's on your areola, then more than likely it's a clogged Montgomery gland, so it would be on the Montgomery bump itself. It can resemble a pimple or a blister, and with that being said, that means it can be filled with clear fluid, milk, or pus. Understanding what a bleb is, how it got there, what caused it, can really help narrow down how to get relief and make it go away. I understand that it can be so tempting to want to poke it and pop it and break it and make it go away, but that's not always the best thing to do. Popping it and squeezing it like a pimple can really cause some damage and scarring, and if it's on your nipple, we really don't want that. So how do we get rid of it? Do you need antibiotics? Like mastitis? Maybe not. For example, if it's clear fluid or milk filled, then more than likely it's not infectious. And if it's not infectious, then antibiotics usually are not needed. So what about the pus kind? Well, again, it depends when it comes to antibiotics, because if we think of pimples, we don't often run for antibiotics just for a pimple. Blebs can go away just as quickly as it showed up, or it can take the better part of a week for it to completely resolve. Either way, it is a pretty painful thing. It is not comfortable at all. A knowledgeable lactation consultant can help guide you through relief and making it disappear. So far, we've gone over nipple sensitivity, engorgement, thrush, clogs, mastitis, and blebs. It's a lot of information, and we still have one more to go. So I do have a not so fun fact and a fun fact for you before we move on to our last point. So not so fun fact, everything that we've already gone over can still happen with nursing too, not just while directly nursing from your body. The fun fact is that not every lactation journey experiences all, and sometimes none of these things are experienced on a lactation journey. My wish for you is to have a very calm, peaceful, and enjoyable journey. When the right tools and knowledge in your toolbox are paired with professional lactation guidance, you are more likely to reach your Milkies goals. The struggle exists, but that does not have to be your story. I guide families through their entire lactation journey with the Breastfeeding Success System, and it teaches them exactly what to do. Plus, they get lactation guidance directly from me, and it's linked below. We have one more thing to talk about. So last but not least, the latch. When it comes to the latch, we're not going for picture perfect here. We're going for comfort and functionality. Being comfortable and having proper function are the two main points for a good latch. When thinking about a latch that causes issues, the first thing that comes to mind is pain. There could be a shallow latch, so this is where the baby's mouth isn't open wide enough before going onto the breast, or they don't have a ton of breast tissue in their mouth while they're sucking. And oftentimes they may be sucking mainly on the nipple versus having areola and, like I mentioned, more of the breast tissue in their mouth. When they don't have a wide enough latch and it's shallow, their lips can be curled in, and they may be squeezing your nipple with their lips or pinching it even with their tongue. This adds more pressure onto the nipple, and it can cause that pinchy, ouchy, toe curling feeling. Ugh. Ow. Sorry, mamas. Tongue ties or oral restrictions is another one. These can affect baby's ability to latch effectively or even remove milk appropriately from the breast. It causes discomfort for both you and your little one. There is a difference between tongue ties and oral restrictions. While tongue ties can be a form of oral restrictions, not all oral restrictions are tongue ties. That's a tongue tie to say in itself. And if you are wondering if your little one has a tongue tie, what a tongue tie is, or what the difference between a tongue tie and oral restrictions are, I'll leave a link to that video at the end. Awkward positioning. Awkward positioning. Even with a comfortable latch, weird angles and uncomfortable holes can cause discomfort for you while baby is latched on. They may be trying to pull away, which causes a ton of pain and discomfort in itself. Okay, so what should a good latch look like and feel like? Let's go ahead and picture a comfortable and effective latch. This is where your baby's mouth is wide open before they start sucking or before they get onto the breast. I like to look at babies' cries and yawns to even understand if they're capable of opening their mouth super wide. When onto the breast, their lips should be flared out, flipped out, kind of like little fishy lips, and their mouth should be covering a large portion of the areola, not just on the tip of the nipple. With a deep latch, their chin should be into your breast, and their nose does not have to be smothered into your breast, but it should be pretty close. You're also going to want to hold your little one close to your body, which allows them to get that chin very close to your breast. So think chest to chest or belly to belly. There should be strong but comfortable suction. In the beginning, many babies don't have a super strong suck, and that is okay because they're developing their muscles and learning how to suck. It is developmentally appropriate to learn oral function. Many times it's thought that babies come out knowing how to suck at the nipple, but the thing is they might know how to suck their hand, and taking milk out of your breast is something they haven't done before. You both are learning together, and learning can take some time. That's okay. While at the breast and they're sucking, sometimes you might not see a whole lot going on in their face. Sometimes you see a little bit of jaw movement, but you should hear sucking, swallowing, see a pause while they're breathing, and then they resume to sucking, and then they'll swallow and breathe again. Depending on your baby's position, you may notice that their tongue under the chin, you're not going to see their tongue, but you may see a rhythmic like motion that correlates with their tongue massaging your nipple. As their tongue massages your nipple and part of your areola, they'll also suck, which brings the milk out. So what can you do if the latch is causing you pain? First things first, unlatch your baby gently. Don't just pull them off. Use proper technique in order to unlatch them. Take a deep breath, drink some water, and try again. Be patient. Lactation is natural. Breastfeeding takes practice. It is a learned skill that both you and your little one are learning together. So please give yourself some grace and be patient with yourself and be patient with your little one. It is common and normal to have to unlatch your little one multiple times. And I'm not talking 2 or 3 times here. I'm talking 6 times or more within a single nursing session to get that comfortable latch. Muscle memory is important with your little one. So we want to teach them to identify the right motions. Experiment with different positions. What is comfortable yesterday might not be comfortable tomorrow. So it's okay to try out different positions, different pillows, no pillows. And depending on the age of your little one, of course, the latch can change, nipple sensitivity can change. They can be super distracted. So it's really important to just try out different positions. The best position is the one that's most comfortable for both of you and allows for milk to be transferred into their little tummy. If you're not sure what different positions you can try, I'll link a video below that has a bunch of different positions that you can try. Please get some help, seek help, and do not suffer in silence. The sooner you get help, the sooner things get better. Waiting for something to get worse or for your hair to be on fire before seeking help is not advisable. If you're already on your journey, then you notice that every day something is different. So that also means waiting extra time, waiting days can impact your entire journey. I work with families to reassess latches, identify issues, and help them be as comfortable as possible in our breastfeeding success system, which is linked below. It is important for families to be able to enjoy their journey and experience that pain-free feed. Just because I've listed 6 common things that can cause discomfort along a lactation journey, it doesn't mean that they're all normal. It doesn't mean that you have to experience them. Leave a comment below, connect with other mamas, and I'll see you in the next video.